Hello everybody, this is Sharon Parlia. Today we're going to talk about Module 7, which has to do with orders and results pertaining to an electronic medical record. As I mentioned previously, one of the big advantages of an electronic medical record is the ability to electronically place orders and have the results resulted back into the chart. So today we're going to talk about how to place an order on the current visit or new encounter, and administratively how to do a procedure order. Once again, we're going to use OpenEMR to demo what I want to talk about tonight, the procedure orders, specifically labs. And this is just an overview of what a order screen looks like. You can see the patient information up on top, the patient name, and on the bottom you can see that we can choose an order. And in this particular case, you can see where an order was placed for a lab. There was under the procedure order for Billy Smith on the bottom left side, and this is where a physician would place an order for a lab, and it would actually be sent through the interface over to the lab. Again, we're looking at this through OpenEMR, and you see that this is an encounter, and you see the patient's name, and this is actually the procedure order. So in this case, you can see the patient information, you know, who the patient is, all their contact and demographic information. And on the pop-up screen, you can see that for this particular encounter, a procedure was ordered, specifically a lab, and it describes the type of lab and you know, the priority and the status. And in this case, the lab order was routed over to the lab. And just to review for orders and results, there's always several ways to look at the same information, and here I just want to show you that on the left toolbar you can click under Procedures. On the Procedures tab you can click on Configuration, and what will happen is the order will it'll actually show what was ordered, and we just saw that on the previous screen with the lab. Continuing on with ordering a test, you also want to see the pending review as well as the results. Sometimes the results come through an interface, sometimes they're entered in. Here you can see on the screen that when this order was placed, the date, the name of the order, it was a lab order, and you know, there's a place for to document where the time that it was collected, the specimen type, and the status. In this case, the status is pending, and this is just to keep you on track to know the status of an order at any given time. As I mentioned before, you can actually manually enter results right into the chart, or you can have the results come across an interface. In this case, again, we're using OpenEMR. I'm just pointing out where you would look, what you would click on to see the results that come across the interface. So under Procedures, Patient Results, this is the screen it would come through on. Because I was in a test environment when I created this screen, you can see where the information would be, but at this point in time the actual result had not crossed the interface. I just want to mention about pending orders. As I said, on the left side of the screen you can navigate through the tabs, and you can click actually under the Procedure tab, you can click on Pending Orders, and you would actually see a pending order report pop up. You would see where the orders were routed, you know, the name of the order, the patient's name, the actual order, and where it was routed to. and actually just, the status and priority, whether it was a stat order, a normal order, standing order, and the status could be the pending, routed, or final. Next, I'd like to talk about ordering medications, and I'd also like to talk a little bit about e-prescribing. So let's start from the main patient screen where all the information is, and if you look on the right side of the screen on the bottom, you would see the word prescriptions, and if you click on edit, I'll be able to show you how to order a prescription. Again, this is in OpenEMR. So once again, we're going to be doing an order. This time we're going to be ordering a medication, and to highlight, we clicked on the edit box, on the edit tab in the prescription field, and the prescription order popped up, and we're going to fill in all the fields, the actual drug that we're ordering. In this case it's Lipitor, the provider's name defaulted in, the date defaulted in, the quantity, the dose, how to, and actually how to take it, and we also will put in the number of refills, and we will also check whether or not we want to e-prescribe, meaning that once we send the order, the order for this medication, the actual prescription, rather than print out in the office, the order will be sent right to the pharmacy, and you can pick it up right at the pharmacy, so there'll be no paper handed to you when you leave the office that day. Okay, but where does the prescription actually print? As I mentioned previously, you can e-prescribe, but not all medications can be e-prescribed. For instance, in many states, narcotics still need to be printed out. So you can print a prescription or you can fax a prescription. And this is where we would determine how we're going to, what we're going to do with that prescription. As I mentioned, sometimes we do need to print a prescription, and what's great about this is the system will actually produce the printed prescription. As opposed to a doctor handwriting the prescription, which was often illegible and difficult for pharmacists to read. Now it's nicely printed out on usually prescription type paper, with the physician's signature, electronically signed. In this case, on the screen, the physician would actually sign it, but it's much easier to read than the old handwritten prescriptions. And then the patient can take this to their pharmacy and have it filled. Once again, you can have prescriptions printed depending on your pharmacy. If they accept e-prescribing, that's often the preferred method. But either way, it works. Thanks again for joining me on this module.